they're actually starving to death, not aging. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. In senior cats, if we group their most common diseases into categories, one of the ones we see really often is hyperthyroidism. Essentially, the body is producing too much thyroid hormone. We get all sorts of side effects from it, but essentially their body is starving to death. So if you have a cat with a really good appetite, but they're losing weight, we may be talking about hyperthyroidism. Let's dive deeper. Many cat caretakers are familiar with hyperthyroidism, either because they've had a cat diagnosed with it or a friend's cat is diagnosed with it. It's just a really common disease, so you tend to hear about it. What we don't talk about as veterinarians, and I really think we should because it may clear up some confusion, is the fact that thyroid disease is actually due to a tumor. Now, this tumor would be considered benign, meaning it's not going to spread anywhere else in the body, but it's a tumor, so it's growing and it's changing, which means unless we take that tumor out, we can't cure this disease. We're merely managing it. Now, there is a less common version, which is an aggressive tumor that will spread and cause problems. Fortunately for cats, that happens less often. So usually we're talking about a thyroid adenoma. That would be the fancy medical term. But because of this thyroid adenoma, we're constantly treating, monitoring, and adjusting with these cats. So let's back up a little bit and talk about what you may be seeing before a diagnosis. You may have a cat that has a really good appetite. They may be drinking more. They may be more active. They may have a high blood pressure that was found on an exam. Some of them have skin problems. But generally, the most eye-catching, consistent finding is that these cats have a really good appetite, but they are losing weight. That history or any of the clinical signs that I just mentioned lead to us doing blood tests. A lot of cats can be diagnosed simply by one screening test. Some of them, in true cat fashion, make it a little bit more difficult. There's a couple of tests we have to run to confirm. Okay, this cat is probably hyperthyroid. Let's do something about it. The traditional or gold standard version of treatment for thyroid tumors is something called methimazole. Basically, it's a medication that you give to your cat on a daily basis to regulate that thyroid hormone. Because this is such a common disease, there's a tablet version, there's a liquid version, there's even a transdermal ear version that actually works. So if you haven't heard me rant about it yet, just because a drug comes in a transdermal version doesn't mean it necessarily works. Methimazole is one of the ones that does work. Newer treatment options that have come about include a prescription food, which addresses the fact that thyroid tumors need iodine. So there are cats that if they will eat the prescription food, eat it well enough to maintain their weight and get absolutely nothing else, will regulate their thyroid without having to have medication. And then there's a third treatment option called radioactive iodine therapy. This is technically a curative strategy. The majority of cats, and I don't have the statistics offhand, but the majority of cats that get radioactive therapy only need one treatment and they are cured. Occasionally there is a cat that'll need a treatment or two, but this is a non-drug way to manage hyperthyroid cats. And then the fourth way, which has fallen out of favor for a number of reasons, is actually removing the thyroid tissue with surgery. I'm not going to go deep into that one because, again, it's as far as treatment options go, it has fallen out of favor. I don't generally recommend it, and even if it is something that is on the table for consideration, you should really be talking to a surgeon about it, not me. But for the majority of our cats that are taking some version of methimazole, we have to monitor them regularly. So generally speaking, most cats do really well with every 6-month monitoring, meaning they come in for an exam every 6 months, blood work every 6 months, blood pressure, monitor their weight, all of those things. And it's not uncommon, the reason we do this, it's not uncommon that thyroid adenoma has changed and we need to change our therapy strategy. Other things that unfortunately aren't uncommon when we're treating thyroid disease is that kidney disease can be uncovered. Treating thyroid disease doesn't cause kidney disease, but because of the blood flow relationship between the thyroid and the kidneys, that change in blood flow can show us that there was already kidney disease present or damage to the kidneys. So, in true cat form, cats like to collect diseases. It is very common for a cat to be diagnosed with hyperthyroidism and chronic kidney disease. Now, that does mean we have a balancing act where we need to keep the thyroid gland regulated enough for the cat to maintain their weight, but we also need to keep the blood flow to the kidneys sufficient enough that that isn't causing clinical signs. It is very important to consider that we shouldn't leave the thyroid unregulated in hopes of helping the kidneys. That's a short-term fix that we can see on blood work rather than it playing out in your cat's quality of life. As I mentioned at the beginning of this video, hyperthyroidism essentially means your cat is starving to death. While we don't like chronic kidney disease or any of the side effects that come with that, I can tell you, I wouldn't want to starve to death. It is very important to consider what we are doing to manage thyroid disease if we have kidney disease present and how to balance those to keep the cat feeling their best. With successful treatment, cats that are hyperthyroid do really well for quite some time, unless they have that more aggressive thyroid cancer. The bonus is most cats don't have that aggressive thyroid cancer, and if we keep the thyroid under control, they do really well and have a great quality of life. It is important, if your cat is eating excessively or eating normally and losing weight and can't put weight on, we need to find it. Now, because it's such a common disease, it is also very common for people to ask, what causes it? How can we prevent this? And like many things with medicine in cats, we don't know an exact cause. There's been so many theories over the years, but there's not one thing that we can absolutely pinpoint this to, which means just like many other diseases, it's probably multifactorial, meaning there could be a genetic component to it. There's probably an environmental component to it. It is very important to know that the chances of your cat becoming hyperthyroid because of one specific thing you are doing is pretty slim. One of the major medical breakthroughs that has happened in the last 40 years is that we have learned how to manage hyperthyroidism. If we can figure out how to prevent it, that would be spectacular. But at this particular moment, we don't know the exact cause, and I'm not certain we'll ever figure it out. But we'll see. The important concept to remember is that unless you have that thyroid tissue removed surgically, or your cat has a successful radioactive I-131 treatment, we aren't curing hyperthyroidism. The medication we use and the food we use is managing it. So your cat's gonna need routine follow-up with their veterinarians, including lab work, blood pressure testing, weight checks, all of those things. And it's not uncommon that along the way, we tweak our management strategy. So it's not something where you're gonna get a 30-day supply of medication, you can give it and poof, everything's better. This is a lifelong thing that we're dealing with. And I don't think as a veterinary community, we always get that point across that this isn't a disease we typically cure. It's something we manage, but we do tend to manage it with quite a bit of success. So to recap, if you have a cat that's eating normally or eating excessively and losing weight, hyperthyroidism is something you want them screened for. If they are diagnosed with hyperthyroidism, we want to watch their thyroid blood value. We also want to watch their blood pressure because that's part of the disease process. And we need to find a way to manage them as a lifelong strategy unless we are talking about radioactive I-131 therapy or surgically removing that thyroid mass. I hope this video helps clarify some of the common questions that come up around this disease. And if you found it helpful and you know a cat caretaker who has questions about thyroid disease, please feel free to share this video with them. Thanks for watching.